lipstick or eyeliner, and that's definitely worrying. So I'm going to meet Dr. Danielle Meagher to find out more about Botox. Do you find that there's more and more people coming to you for procedures?
The numbers and the figures are just growing. At the end of the day, if you look at a Botox treatment, it costs probably about €500 and you might need that every 6 or 8 months. People spend €100 on their nails every 2 weeks on refills and on their hair every 4 weeks. So unquestionably, Botox is here to stay.
And how often do you have to get the Botox?
The first time you have it, normally you might have a repeat after about 4 or 5 months. And then after 2 sessions of it, you might be finding that you'll get 8 or 9 months out of it.
And for the best results, what age would you be when you have to start getting Botox?
I like to have 30 as a rough guide, because it prevents from very young girls coming in and saying, we want Botox. If you frown now, do your best frown.
How do you frown?
Just look sad. You see, you have absolutely no cause for, you've no cause because you have absolutely no lines. If you had frown lines across your forehead, or some people have those, those really angry lines, that's what Botox is used to treat, and it eases them out. And then if you do a big smile, sometimes when people smile, they'll have little lines around their eyes, and again, you've no lines. Now, obviously, you'd be way below the normal age bracket, but they're the sort of tests that we would do on someone when they came in.
Do you think that girls in their 20s and younger are seeking invasive and non-invasive treatment?
I think teenage girls and girls in their 20s, it's such a huge time in your life when it's just you're riddled with insecurities, and I think obviously again then you read something in the press about having one of these treatments, and you do have people come in their 20s and there's the door. If you'd like to buy some creams or something that might help moisturize your skin, it's a little dehydrated, we'll happily advise you on that. Or if you'd like to have teeth whitening, but I'd be very straight up with younger patients and say you don't need it yet, whereas they could knock on a different door and come in, we'll take your money, and we'll give you Botox. I'm sure that definitely goes on.